Namaskar दोस्तों, welcome to channel Toxicology on Board. Today in this video we'll be discussing another important topic that is non-intentional food additives. So in this video we'll be discussing about regarding FDA, the process how the FDA gives approval to the food additives. So this question is taken from ABT recertification May 12 2000 question paper, and the question is which of the following is non-intentional food additive. So we need to identify out of the five options, which is the one which is not food additive. So even though this type of there is a revision in the DABT exam where four option questions are there, five option questions are no longer given in the exam pattern, but yet by going through these previous questions papers, we will be able to learn about the concepts related to that, which are still a part of a DABT brochure or syllabus you can see. So the options are, again I'll repeat the question. The question is which of the following is non-intentional food additive. We have option A monosodium glutamate, we have option B diethyl phthalate, we have option C sodium benzoate, we have option D that is propylene glycol, and option E sorbic acid. The right answer will be in the green text, that is diethyl phthalate. Okay, so first we will understand something with respect to diethyl phthalate. If you look into this diethyl phthalate, no, it is a clear odorless liquid. It is used as a plasticizer. The main use of diethyl phthalate is it is used as a plasticizer. Okay. So that is the reason the answer is it is a non-intentional food additive. Okay, to make plastics flexible and as a solvent fixative in perfumes, cosmetics, and some medicines like even in the aspirin, increasing product durability, that is plastics, fragrance longevity, though it's not a chemically bound and can leach out. So with this respect, since it is a part of the component of the plastic, so there is a possibility of leaching. So you need to read about extractable leachables also with respect to this. Okay, so diethyl phthalate is a type of phthalate. There are different types of phthalates are available, but in this option diethyl phthalate is there. In next slide I will give you the list of phthalates which are given in the Wikipedia, and the type of toxicity is also there. We'll see in the next slide. So coming to this specific means to diethyl C2H5 two times is there, is a type of phthalate often used in food packaging, toys, car parts, and is generally considered as safe for cosmetic use by the regulatory agencies. So regulatory body has already given approval the use of diethyl phthalate used in the cosmetic purposes. But some studies suggest, few studies are there which still say that there is a possibility, there is a potential that this particular diethyl phthalate may have developmental effects at high doses. So again, dose response curve is important. Any substance is hazardous, adverse, until unless it is used in extreme high amount. So in this case also diethyl phthalate, when it is used in regulatory limits, it is fine. But when it is used when the levels are too high, there is a possibility, there is a potential for developmental effects. Okay, but still there is no direct relationship or publications which is association with the human. Okay, so they have seen in the animal trials, but not there is no direct association with respect to human. So diethyl phthalate is generally considered less harmful than other phthalates. So what are those other phthalates? Other phthalates means instead of diethyl, no, ethyl, that is C2H5 will be replaced with some other organic molecules like methyl or butyl, like that, with low acute toxicity but high or repeated exposure in animals show. I told you, no, any chemical when you read, you have to read about acute toxic effect and you have to read about chronic toxic effect. So diethyl phthalate, when it is exposed acutely, it is having less toxic effects. But over a period of time, repeated exposure, there is a concern, there is a potential for it might damage your liver, metabolic insulin signaling, and reproductive issues. As we have seen here also, the potential developmental effects at high doses. Okay, including reduced pup weight, birth defects, and direct human cancer reproductive harm evidence is limited. As I told you, making it a mild irritant at worst in typical use, but a potential concern at very high levels. So dose is very important. So as such, this particular type of phthalate is less toxic. Another important thing with respect to this question is that in the question they have given non-intentional food additive. Maybe if they, instead of using the term non-intentional, they may use unintentional or indirect food additive. So all this also comes under the same concept. Okay. And FDA approval methods, if you see, go back and check in FDA website, it is very clearly given that. So in order to, if you want to approve a new food additive, it falls under 4 types of approval category methods. One is food contact substance notification 1. Second one is food additive petition, FAP. Threshold of regulation, that is TOR, and generally regarded as safe, so GRAS. So about all these type of 4 approval methods we'll see in the third slide. So this I was talking about, this you can read in the case of Wikipedia also, they have given directly, I have taken from there only. So they have given on the complete left side, you can see type of phthalates and type of the potential toxicity of concern are there. So I have given color coding also, type of phthalates which are having toxic to reproduction and endocrine disrupting. Some of them are only affecting reproductive toxicity, some of them only causing endocrine disruption. So you read. So those people who are working in medical devices, no, for made of a plastics, no, so they will be dealing with extractable, leachable. So they have to do risk assessment, or they need to calculate tolerable exposure as per ISO guidelines for these type of plastic components. Okay. So those type of toxicologists, medical device toxicologists, the risk assessment, they will come across this kind of list. Okay. So we'll see now we'll see about the question. The question was about indirect food additive. So we'll read something with respect to indirect food additive, what it is. So indirect food additives are substances that unintentionally become components of food. Initially, they do not have any nutritional value. They were not added for purpose. They have unintentionally became a component of food, either through packaging, means packaging materials, from the packaging material, it might leach into their food, or during processing. So during production processing, when you're producing or processing the food on a larger amounts, no, there is a possibility of exposure to this type of additives or handling, regulated under 21 CFR parts 174 to 178. It is 74, 75, 76, 77, 78 by the FDA. So if you go back and check in Code of Federal Regulation, in this website will be there. There they have given, you see, 174, 175, 176. So please read in detail. One slide I cannot cover everything. So go and read about this type of 21 CFR parts 174 to 178. Next we will see these materials, indirect food additives. No, examples are adhesives, coating, papers, polymers. They must be safe for their intended use and are often subjected to, this is important, pre-market notification is very important. Okay. So what is the definition which is given by the FDA is, this indirect food additives, no, they are the substances that may reasonably be expected to become a component of food or affects its characteristics. The food color might change, appearance might change, smelly through contact, whenever that indirect food additive is coming in contact with the food. So what are the regulations? We have discussed 21 CFR part 174 to 178. Examples also are there. Coming to safety standards, they must, this indirect food additives, no, they must meet a standard of reasonably certainty of no harm. These additives should not cause any harm under intended conditions of use. Okay. So what are the different approval methods? In the first previous slide we have seen food contact substance notification, an effective pre-market notification for a specific substance, this one. Next, a food additive petition, that is a formal petition process you have to do to the FDA. Forms will be there. Then threshold of regulation, TOR, which includes exemptions from substances with low migration level. The migration from the whether it is from the paper or the adhesive or polymers, it is in very low levels. And fourth one is generally regarded as safe. This generally regarded as safe, they have a GRAS list will be there, which FDA will give. So these are the substances exempted from the food additive definition due to safety consensus. Okay. So this is the thing you have to remember. And remember, GRAS It is given in the DABT brochure. Okay, if you see page number 17 or 18, they have given under the references section, they have given. So this is the thing you have to read. They have given the link also. So in that frequently asked questions about GRAS is there, so which is a part of syllabus. So please go back and read about this document, which is around 11 to 12 pages document is there. Okay, and read, try to read about GRAS definition also. Okay, then we'll see option A. Why option A is not food unintentional food additive, we'll see. So option A is MSG, that is monosodium glutamate. So those people who eat Chinese food, they I have come across this word monosodium glutamate. It is widely used flavor enhancer. So in the Chinese food, street foods, you see that MSG is added. Why? It gives savory umami taste to foods composed of. So what is this MSG is made up of? It is made up of sodium, and it is made up of amino acid glutamate. And glutamate is the thing which will whenever it comes in contact with our tongue, no, our receptors, sensory receptors, you feel like a euphoria. You will feel savory. You feel like eating more tasty, taste enhancer it is. So it is produced by fermenting starch, sugar beets, and sugar cane. And FDA, if you look into FDA, there is a wrong misconception that MSG has some adverse effects. But FD, if you look into real actual facts, FDA has given monosodium glutamate GRAS status, means it is generally regarded as safe, and it can be used in soup, snacks, as well as and sauces to enhance the flavor. And there is another myth is there, that Chinese restaurant syndrome. This is a term which is associated whenever you discuss about MSG. So another name it is MSG symptom complex. What are the symptoms you will see? Even a set of temporary self-limiting symptoms, those are headache, flushing, sweating, numbness. But these are very temporary, and it is only found in some individuals, some sensitive individuals only, and that too at very high amounts. And see, in the food, you will use a pinch of MSG you will be using. So you will never get such kind of extreme adverse effects when if you are using MSG as a flavor enhancer. So you can pause the video here and read in detail about what are the intake levels which are given, at what concentrations it is really going to cause, if it is causing any adverse effects, and what is the history, why this term Chinese restaurant syndrome has come associated with this MSG. Okay, there are only one or two publications where there with by this particular person, not in detail, and scientifically it has not been accepted or proved. Okay, then we will see about option C. Option C was about sodium benzoate. What is sodium benzoate? It is a preservative. So we will see sodium benzoate. This is the formula, molecular formula. This is also, it is an FDA approved antimicrobial preservative. Okay, so it is used to inhibit bacteria, yeast, and mold growth in your acidic food, beverages, as well as in cosmetics. You can see on the bread also, you will be seeing, okay, bread, jam, soda. So this sodium benzoate, no, it is highly effective in products like soda, salad dressings, jams, etc. Okay, and important thing you have to see, FDA has given one number, E2111. Okay, this FDA, no, for food additives, it gives a series of numbers. It gives, like in the case of impurities, or in the case of ICH guidelines, how you have ICHQ guideline, S guideline. Similarly, for this additives, no, this FDA will give E numbers. Okay, so this is given. This sodium benzoate is given 211. So how? Because the importance is, it is, you act as a preservative. So all the preservatives which are approved by the FDA are given the series E200 to E299. This you have to remember. So pause the video if you are interested. See, so those people who are working in risk assessment, they'll be using coloring dyes, no? So it falls under E100 to E199. So like that only you look into the numbers. Okay. So coming back to sodium benzoate. So this sodium benzoate, it is generally safe at high consumptions, may carry risk. And what are those risks? Hyperactivity, allergic reactions. Most and whenever this is coming in contact with vitamin C, na, in your drinks, it is a component of soda, no, the sodium benzoate. It will form carcinogenic substance, that is benzene. So benzene is well known. It is been reported that the carcinogenic risk is associated with benzene ring. So what is the mechanism how the sodium benzoate is acting as a preservative? What it will do? It will enter into the microorganisms, your bacteria, your yeast, and in acidic environment, disrupting their growth and metabolic process. So it will stop the bacteria from multiplication, thereby it will act as a preservative. Coming to safety status, FDA and other international bodies have given GRAS status, very very important, generally regarded as safe as sodium benzoate. So what are the potential health risks associated with sodium benzoate? Allergic reaction, that is only in few sensitive individuals. Okay, rashes, which is irreversible type of thing. Then benzene formation, not in all products, only in soda such kind drinks are there where vitamin C is there, that coming in contact with sodium benzoate, because sodium benzoate mein benzene ring is there, probably that is a reason for the formation of benzene, and it is causing there is a carcinogenic risk associated with it, that too in a high concentration, not the the concentration in which we are consuming in the drinks. And coming to high intake concern, yes, extremely high doses in the case of animals, there are some potential damage to the kidney and liver, because these are the two organs where metabolism is taking place. Okay, but the association, such adverse effects on the liver or kidney, such association with human has not been yet proved or found in the literature. Okay, so now we'll see the option D. Option D was propylene glycol. So propylene glycol is also not an unintentional food additive. So we'll understand in some information that with respect to propylene glycol. So first I would say that propylene glycol has been listed under Clason's toxic effects of solvents and vapors. So there you will be reading about ethylene glycol. There you will be reading about propylene glycol, and below that in the same you will come across glycol ethers will be there. Okay, diethyl glycol, DEG will be there. DEG, which is associated with sulfanylamine eczema tragedy, is there, no, that also you read. And polyethylene glycol being a part of this I wonder, cup syrups causing kidney damage in the case of children, that you read. Okay, then so let's go back to the this thing propylene glycol. What the important things that are mentioned in the Clason textbook? Propylene glycol is used as an intermediate in the synthesis of polyester fibers and resin, component of automotive, that is antifreeze and coolants, and a desiccating fluid for aircraft. So what happens, this aircraft, no, if ice formed on the aircraft, to cool that one, to remove the icing, this used as an antifreeze for coolants. Earlier in refrigerators, no, our old refrigerators, I remember my childhood, antifreeze, that is freon particles were there. So PEG was used as an antifreeze, okay, and as a designing fluid in the case of aircraft to remove the icing. Okay, propylene glycol is also again generally regarded as safe. So it is not an unintentional food additive. It is declared food additive by the GRAS. It is a constituent of many cosmetics and processed food, since it is very safe to use. And what is the main purpose? It is used as a solvent and diluent for a substantial number of oral, dermal, and IV drug preparations. Okay, it is used as an excipient in the preparation of pharmaceutical preparations. And what is the major route of exposure of this propylene glycol? Is either through oral ingestion or dermal inhalation. Not why? Because you go back and read, probably it is because of the density nature. It doesn't exist in a gaseous form or volatile form, where inhalation exposure is not the major concern. And the propylene glycol readily metabolized by, very important. So the metabolism of any particular solvent you have to understand. So this propylene glycol, no, it is metabolized by this alcohol dehydrogenase, and lactyl aldehyde is formed. Alcohol is converting into aldehyde. Aldehyde is converted into lactate by action of this enzyme aldehyde dehydrogenase. So similarly, stop here, go back and revise yourself. We have discussed in my channel also, we have discussed ethanol. Ethanol is undergoing also metabolism by same alcohol dehydrogenase and aldehyde dehydrogenase. Okay. Similarly, we read about methanol also, and also read about isopropyl alcohol, that is rubbing alcohol. What is the metabolism? What are the toxic metabolites which are formed after metabolism? Then we will see excessive lactate. So what is this? Whatever the excessive lactate, no, what it is causing? It is causing acidosis, not too much of toxic. When compared to methanol, there oxalic acid will be formed. Okay, sorry, formic acid will be formed. Okay, which will cause blindness. So in that way, it is not too much toxic. Yes, lactate is formed, but lactate, what it is causing? What is the adverse effect it is causing? Is it is causing acidosis. Okay, then propylene glycol has a very low order of acute and chronic toxicity when compared to other glycols. No, this is less toxic. So one more important thing during my work, I have come across is that we'll be frequently getting about FDA notification, like observations that whenever there are something like diethyl glycol meter or DGME, diglycol ethyl methyl ether methyl. So such kind of always they will be more cautious. This inspectors whenever they want a proper risk assessment on this type of DGME or EGME type of glycol ethers. So read that also in detail. Then we have option E. Option E we will be discussing about sorbic acid. So sorbic acid and its salts. So it exists in the form of potassium sorbate. This is also given GRA status by the FDA. That's why it is not an unintentional food additive. Okay, and it is also having very low acute and chronic mammalian toxicity. Because of the low toxicity only, this always FDA is giving GRA status to this type of preservatives or salts. Okay, so sorbic acid main purpose, it is used as a preservative. It is metabolized similarly like of fatty acids in our body. This also undergoes same type of metabolism. I didn't find too much information in the Clayson. I didn't find the metabolic pathway also with respect to sorbic acid. If you have an option opportunity, go back and check and look into this. Is there any mutagenic or non carcinogenic risk? No, sorbic acid is non-mutagenic and it's not causing any cancer. And only few cases they have found that it has idiosyncratic intolerance reactions. So pause once again here. So something you have to I keep repeating in my videos. Read about idiosyncratic, idiopathic, iatrogenic. Some these are the one or four, two, 3 to 4 terminologies are there which are starting with I. Okay, go and read. You will be keep getting confused with this terminology. So read. Okay, coming back to sorbic acid. So what are the key toxicology concern? It has low acute toxicity. If you see LD50, no, it is 7.4 to 10 gram per kg. So you have to understand generally LD50 will be in mg per kg when it is come to oral route. Here it is in gram, means up to 7,400 mg you can the mortality LD50 I'm saying. So it is completely low toxic. Coming to chronic toxicity at high concentrations, no, you have some significant adverse effects will be there, but at a very high concentration, that to chronic repetitive administration should be there. So metabolism is similar to like that of fatty acids, and the byproducts which are formed is carbon dioxide and water. Okay, there is no genotoxic or carcinogenic risk. Okay, few cases literature they have found with respect to potassium sorbate, where they have found some kind of DNA damage is there, but there is no clear link with respect to carcinogen, and there is less human risk also. Coming to sensitization, yes, we have seen idiosyncratic contact urticaria is there, that is pseudo allergy or skin reactions, but these are all local reactions. They are reversible once you get away from that particular exposure after certain period of time. All these reactions are reversible. Coming to safety limits, important thing, EFSA has given to sorbic acid acceptable daily intake. That was temporarily previously. I don't know, you go back and check if the current 2026 or we have any ADI for this sorbic acid. Earlier it was 3 mg per kg body weight. Okay, so important thing you need to understand that there is a science is dynamic. So new literature, new publications will be there. So whatever the ADI values which are established, safety limits which are established by the either by the regulatory bodies or by the toxicologists, no, scientists, no, these are dynamic. They keep changing once you get new literature. That is the reason they are saying. So need of updated studies, though overall safety remain high because we have seen that most of the thing it is not having any adverse effects. So just we'll quickly understand ADI. No, this is acceptable daily intake which is given to the food additives. Okay, this is, and it is a type of HBL, that is health based exposure limit, that you have to understand. And there are different types of formulas are there for each type of HBL. Like permitted daily exposure you have, where 5 factors are used, uncertainty factors, and you have tolerable exposure with respect to extractable leachables, where you have 3 factors will be there. Okay, different types of products will have, but the basic concept is that they will consider point of departure, that is NOEL, safe level, that they will extrapolate it to human. So similarly in the case of ADI, the formula is known by uncertainty factor. So uncertainty factor here you can consider 10 or 100. Okay, if with respect to food additives. Okay, so hope from this video you will are able to learn about food additives, how the process approval methods are there by the FDA in order to approve a food additive. And we have seen some other options like sodium benzoate preservative and other preservatives, their importance. Okay, so thank you so much. Be curious. For any questions, you can always write a mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on the Board. Thank you. All the best for your exam.